Chapter 24, Lesson 4. In this particular lesson, we're going to talk, as the title shows, is we're going to talk about preventing and treating HIV and AIDS. As you see here, preventing HIV and AIDS, there are many actions that one can take to avoid contracting HIV and AIDS. As we talked about in the previous lesson on the previous PowerPoint, the fact that we know that HIV and AIDS can be contracted through sexual intercourse, IV drug use, and from mother to child. The CDC estimates that about 25% of people in the U.S. who are infected with HIV do not even know that they're infected, maybe because they've been infected from somebody who they themselves didn't know they were infected. They're not showing any signs and symptoms. Many of those people feel like they have nothing to worry about. Really, the CDC and all health professionals really urge people that if there's any way that one could have possibly exposed themselves to any type of risky behavior, that they get tested as quickly as possible. Because research does show the sooner one person gets diagnosed, the more likely it is that they're going to be able to prolong their life expectancy because of the advancement in all the medications that are there. Because they may not know, they may also unknowingly spread the virus to others. So there might be people who are infected and unknowingly are putting other people in harm because of their actions. Ways that you can prevent the spread of HIV and AIDS. The first and most probably important one is practicing abstinence. One should probably wait until they're in a lifelong committed relationship. They have a partner that they're going to have for the rest of their lives. If two people go into a relationship without any risky practices within their past, then there's no risk of acquiring the HIV infection. So practicing abstinence would be first and foremost. Don't share needles. Not that we as health teachers are advocating that somebody is using needles, but there might be people who are diabetic. There might be people who are taking medications through needles. Don't share new needles with other people, but then when people who do for some reason fall into the drug world or the drug culture, don't put themselves in situations where they're using other people's needles as well. Avoid situations where drug and alcohol use might compromise your decision making. People tend to make decisions that they normally would make when they're under the influence. They put their guard down. They're not using their best judgment, and they might put themselves in harm's way. Use refusal skills when you feel pressure to engage in risky behaviors. Learn to say no. Maybe explain why you're refusing. Walk away from that situation if at all possible, but try to use those skills so that way one doesn't put themselves into a risky situation. And knowing as much as you can about the people around you and their behaviors can help you make responsible and informed decisions as well. So diagnosing HIV and AIDS. There are several tests that are used to diagnose HIV and AIDS. If someone believes that he or she may have been exposed to HIV, that person needs to be tested. If somebody is waiting for signs and symptoms, it's probably going to be too little too late. And what I mean by that is their immune system is going to be so weak that even if they take medications, they have a greater likelihood of reaching that final stage, which is the which is the AIDS stage. And also don't wait for someone to tell you that you might be infected, because that message may never come as well. Testing available in a doctor's office, local health department, or hospital, and there's sites that will specialize in HIV testing. There's a lot of stuff on the internet, but most of that stuff is unreliable. So it's very much advocated that one go to a doctor, go to a local health department in order to get specialized testing. A blood sample or an oral specimen from between the inside of the cheek and gum is collected and it's sent to a laboratory for analysis, and results are available within 2 weeks. And there are some tests out there where the results are much quicker than 2 weeks. There's the different types of laboratory HIV tests. The most common lab tests to screen, diagnose, and confirm HIV are the EIA and the Western blot test. The EIA test, which is the enzyme immunoassay test, this is a test that screens for the presence of HIV antibodies in the blood. So therefore the test itself does not actually test for the HIV virus. It's testing to see whether or not your body is producing antibodies in an attempt to fight off that virus. It might be 30 days, in all honesty, it might be up to 6 months before somebody is showing enough antibodies to show up on a test. So if somebody feels like they were exposed to HIV today and they got tested a week, 2 weeks, even 2 or 3 months from now, and that test came back negative, obviously that is very good news, but one has to realize that it might take up to 6 months before one's body will produce enough antibodies to show up on a test. There's also a Western blot test. This is a test that will detect the HIV antibodies and will confirm the results of the earlier EIA test. The Western blot test is just a little more intricate test. Most people who will take an HIV test will actually test negative. So the first test, the EIA, is more of a screening process, kind of weeding those people out. And only the people who test positive would then take that Western blot test just to confirm the results of the earlier test. Other lab tests, two other tests can be used and will be used. We have the RNA and the CD4, which may be run when a Western blot test is positive. So when that Western blot test is positive, these are some backup tests that are also run. These two tests give a more complete picture of the HIV-infected person's condition and if the doctor needs to prescribe medication or not. So once again, even though someone might know that they have the virus, the reason why we take these other tests is because we need to know what their condition is, where their T cell count is, maybe what strands of the virus they have, so that way a doctor gets a much clearer picture where they're at with their disease, what types of medications they should take, because obviously the whole goal is to prevent anybody else from becoming infected, but ultimately helping the person who is infected live as long and as healthy as they can. There's also a rapid test. This is an HIV test that produces results in as little as 20 minutes. Not as accurate as some of the other tests, but a test that certainly can be used. Maybe there's some people who are homeless. Maybe there's some people that are drug addicts. And maybe you're only going to have them for a very short period of time to get them to take that test. Expecting them to come back in 2 weeks to find out the results is unrealistic. So maybe we can get those type of people to take a rapid test. The rapid test can be used in situations where the infected person may not come back to learn the results of that test. There are some home testing kits that are available on the internet, newspaper, magazines, etc. And like I mentioned earlier, these are not trustworthy. These are not advocated. Many of them are not approved by the FDA. And they might create false positives or false negatives and give a lot of people out there a false sense of what they really have and where they're really at. Once again, it's highly recommended that one sees a physician and has that test administered by a health professional to ensure the accuracy of those results. Some of the benefits of early diagnosis. One is to begin proper medical care early to slow down the progress of the virus. You know, someone like Magic Johnson's been living with the virus now for 20 some odd years, and many people are living for 20, 25, 30 plus years with the disease. So the medications out there are doing a great job of slowing the progression of the virus, but one has to know that they have it in order to take those medications. Avoid behaviors that could spread HIV to others. And another benefit of early diagnosis is to gain peace of mind when the results are actually negative. Instead of walking around thinking, maybe I have this, I put myself in this situation, some people quite honestly are afraid to take the test for fear of what the results might actually say. One can gain a peace of mind by taking that test. Treating HIV and AIDS, since the early 1980s, drugs have been developed that slow the growth of HIV and treat some of the symptoms. When we look at some of the medications out there, many people who have HIV right now are taking what's called a cocktail drug therapy. They're taking 20 to sometimes 30 pills a day. Now, it's not 20 to 30 different pills. It might be 4 to 8 different types of medications, and you're taking those in multiple doses. But there are medications, once again, that people are taking, and they're doing a great job. Some of the medications will slow down the replication process. Some are going to boost the immune system. Some will form protective shields around infected cells so viruses can't go out and infect healthy cells. So there's a lot of medications that serve a lot of important functions. And once again, they are doing an excellent job of allowing someone to live a little bit longer than they used to with HIV and slowing the progression into AIDS. There is no drug yet that has been developed that will actually cure HIV and AIDS. So if one becomes infected, they're going to have this disease. As of right now, they're going to have this disease for the rest of their lives. And ultimately, at some point in time, whether it's 5 years down the road, 10 years down the road, 30 years down the road, at some point in time, someone's going to acquire an opportunistic illness that will eventually become fatal to them. Prevention from in abstaining and not putting yourself in a situation to acquire it is obviously the most important thing. Many of the drugs available are also used to treat opportunistic illnesses such as pneumonia, cancers, etc. And another process of treating HIV and AIDS is to slow the growth of AIDS, and patients will take a combination of many different types of drugs. And that's it.